Good afternoon, and welcome to today's SAMHSA-sponsored webinar titled Young People in Advocacy: How We Can Help Elevate Youth Voices in Mental Health Recovery, presented on behalf of the National Coalition for Mental Health Recovery, also known as NCMHR. Today's presentation will be recorded, and the recording link, slides, and a certificate of attendance will be sent via email to everyone who attended today. Closed captioning is available and can be viewed by clicking the CC icon at the bottom of your screen or clicking the link in the chat pod to view in a separate window. We also have ASL interpreters who should be spotlit on your screen. During the presentation, please add your questions and comments in the chat box, and questions will be asked out loud for the presenters to answer at the end of the presentation. When the presentation ends, please take a few moments to complete a brief survey that will show in your browser as you exit the platform. Thank you again for joining us, and we will now begin today's presentation.
Hello, everybody. Thank you so much for joining us. My name is Jo Skinner-Grant. I use she, her pronouns, and here are our learning objectives for today. So first of all, we want to be able to describe strategies for engaging and supporting youth labeled with serious emotional disturbance in advocacy efforts, and that could also be SED. Second, we want to be able to apply Roger Hart's ladder of participation to advocacy work with youth labeled with SEDs. And then third, we wanted to be able to distinguish between the tokenization of youth labeled with SED and true engagement of youth. So here's a little bit about me. Oh, sorry about that. A little bit about me and my advocacy journey. So I am a youth with SED, and I also have been so blessed to have experience with advocacy. For me, these really do go hand in hand. I was diagnosed with learning disabilities when I was 8 years old, and I noticed that students in the special education class were treated differently. Even though I had special needs, I was not in that class, and so I was treated differently. I wasn't bullied, basically, to put it quite bluntly. And so I started working with teachers and other students and the students who were in that class in order to try and help change the conversation and include them in more activities. And I was actually recognized by the county for those efforts. And one of the proudest moments of my life to this day is being 8 years old and getting to take a photo at this celebration with this poster that had been made with all of the students from the special education class and saying, "These are incredible people." And I was so grateful to be a part of that. I've also continued to do advocacy work since then at many different levels, even United States Congress, which still blows my mind to this day that that's something I've been able to actually engage in. And none of this would have been possible without adult mentors. That's why I'm even here today, is because of the support that I've had, adult mentors who encouraged my ideas, taught me tools of systemic change, and have been active partners in supporting these projects. So thank you all for being here, because I know that you all work with youth and are able to be that change in their lives. On to our first topic of engaging and supporting youth. So why engage youth? There's this quote from the disability rights movement, "Nothing about us without us." The systems we work in serve youth, and they're not going to be able to succeed unless we actually engage youth in creating, developing, working on, fine-tuning those systems. Youth need to be a part of it. They have that unique understanding of these systems that serve or fail to serve them. So we really need to make sure we're engaging their voices. We can only support youth if we know what they need. And believe it or not, youth have a very good understanding of what they need. So we might as well ask. And programs that are designed with youth input are then able to reach more youth because you've built that trust with youth. You've shown that this isn't just something that's like parachuting in with the appearance of trying to be helpful. It's something that's actively engaging youth and thinking about how can this program really succeed in our mission to help youth. And so I just want to say, for a little bit, to really frame our discussion, consider, and you can put this in the chat or you can write this on a notepad, whatever is easiest for you. But this first bullet point, really get clear: what is your goal or mission in helping youth? What do you want to accomplish? Whether that's youth knowing that they have a safe space to go in crisis, as an example. So what is your goal or mission? Awesome. Thank you so much. I'm seeing some great things here. I'm seeing making their path a little easier, reducing stigma. We all have gifts. Know that they are special. Empowerment. Thank you so much. These are incredible. And so now, keeping that first answer in mind, how would engaging youth in your work make you better able to meet that mission? And so, yeah, these are the questions on the screen. It's first of all, is the what is your goal or mission in helping youth? And then the follow up to that is of that mission, how would engaging youth help you to meet that mission? Yep. Respect their intelligence. I love that. Self direction. Yes, absolutely. Empowerment. All right. Absolutely. I'm so glad. I mean, I think it does go to say we are here learning how to help youth in advocacy, but this is exactly what it means. It's the empowerment, letting them lead. Um, and so, really moving from this, now that we know our why, our goal in helping to engage youth, I want to move on to how we can actually include youth now that we know we would like them. Ask youth their why. Youth want to be involved in advocacy, oftentimes for similar reasons that we do. They might have similar missions. For wanting to be involved in advocacy work. And so getting clear on what youth are hoping to get out of this. I actually am currently in an internship right now, and we did a learning agreement. And I'm really lucky my supervisor has been really engaging me on what am I hoping to get out? What am I hoping to bring to the table and recognizing that. And so that I think can make it a lot more of a collaboration. So really getting clear on what youth want to do and why they want to be involved in advocacy considering their schedules. I'm currently in school, I'm in college. And so if you ask me to do something in mid-May, it's not going to be able to happen. I have finals week, but then also thinking about class schedules, maybe middle school or high school, it might be 7 to 3, or I don't know what times they're doing it now. I know it was really early back when I was in high school, but being mindful that maybe just the 9 to 5 hours aren't actually the standard hours that children will be available. Having fidget toys, breaks, comfortable seating, pronouns and introductions, and just an intentionally welcoming space is really important. And I think this goes for adults as well as for youth in order to make it a place where people actually feel like they can engage, feel comfortable. I know that a lot of times when I started to engage in advocacy efforts, it can be really intimidating. I can feel like the youngest person there. I can feel a lot of imposter syndrome. And so all of these things that adults, mentors, and even other youth have done to open up the space to maybe have a little distraction, something to fidget with, have made it so much more inclusive. On the topic of inclusive options, I actually want to share a story. At my last university, your grade was almost entirely based on participation, and that meant discussion for the most part. Students would read the material and they would discuss it in class. And I had this professor who would always ask people to submit just a little written reflection on the readings before class. I didn't really understand that. And one day she told me that some people don't necessarily speak up in class, and it's not because they're not engaged, they're not thinking about the work. It's because that's just not the way that they engage best. And so by having those written questions, that written input, we were actually able to hear a lot more voices, have a lot richer of a discussion. And so I just think about meetings, about advocacy, conferences. If you just have one mode of engagement, whose voice are you missing? And with that, thinking about really creative options, I was recently at a meeting where they had people write ideas down on index cards, and those index cards were getting passed around. People were able to collaborate that way. Technology makes a lot of options with chats, polls, Zoom. And the other thing that's really helped me feel comfortable and start to open up is just having one-on-one discussions with adult mentors who would have things like office hours where I could just come in, maybe play with one of those little sandboxes with the rake on it. And I know I find those so calming and just talk about what I'm seeing, what my peers are going through, what I've been going through, and learn more about the systems. So these are all ways that I think it's really important to actually be able to start including and hearing youth voices. And now for collaboration and common goals. Now that we're all at the table, we've started to touch on the common goals. I've heard a lot of discussion about, I think there is to some degree a bit of a hierarchy between this idea of adults and youth, teachers, students, service provider, patient, whatever it is. And I can see that honestly, in my personal experience and opinion, that can kind of get in the way of advocacy a little bit. It can just make it harder to discuss. And I think that I like to think of it as making a cake. I live in a building. I'm lucky a lot of my friends are my neighbors. And if I want to make a cake, I can say, all right, I have an oven, I have a cake pan. I might be out of flour, I might be out of sugar, I might not have chocolate, but I have eggs, I have butter. And I can reach out to my friends and we can all come together. They can bring the flour, the sugar, they could bring maybe some sprinkles, some frosting. I can provide what I have. And when we work together, we can recognize that each of us brings something unique to the table. And together we can make a cake and we can all enjoy the cake that all of us wanted to eat. And it's no longer this idea of, it's not necessarily as transactional, as hierarchical, as much navigating those relationships as recognizing that we actually both need each other. And I think it's really important for adults to recognize, as we just did previously, we need youth if we're going to succeed in this work. It cannot be done without getting that youth input, that sort of insider insights into issues. And so I just made some non-exhaustive lists of some things that adults provide, some things that youth might be able to provide that are, some of them are unique, but if you look at these lists, the last three bullets are basically the same for both of them. And I think part of that is that youth and adults, in my experience, I was much more connected to the community. Say, in developing a collegiate recovery program, I knew a lot more about what was happening on the ground with students. I knew about the message boards that students were using. I knew about some of the concerns we were having. I knew about some of the areas where maybe we didn't trust the adults or the faculty. And I was able to have that understanding and that trust and bring that to the table. And adults had a lot more understanding of what's happening with faculty, what are their concerns. They might have a much better understanding of the resources, of the systems, the trust of other faculty. And I mean, the youth didn't immediately trust adults and the adults didn't immediately trust youth. And so by recognizing what we each were able to bring to the table and seeing it as a collaboration, we were able to start to be that bridge, because at the end of the day, we both had the same goal. We both wanted, in that case, students to be able to access mental health resources on campus. And so when we put that front and center and then say, here's what I can bring to the table, we were able to actually get so much more done. There's also mentorship when we talk about that relationship between adults and youth. I am just eternally grateful. I've been talking about adult mentors who have really changed my life. So why mentor? One thing is that it can help increase the number of talented individuals working in your field. I'm assuming we're all here because we care about behavioral health, we care about youth and their ability to achieve really well-being. And so that only continues if there keep being more people who go into this field. And so mentoring youth is a chance to contribute to that, keep it going, and keep this progress really moving forwards. Also, a chance to help youth grow and develop more broadly applicable skills. I'm going to be honest, I've most of my life I've been more in a mentee than a mentor role. And I think that's just sort of my age and where I'm at. But the chances that I've had to work with other youth and be able to help them step into spaces, it has just been so incredibly rewarding to see that, to see what people can bring to the table, and to see that growth is just intrinsically really motivating and powerful. Some tips for being in that mentor role are bringing youth as guests or a plus one to events. In that, I'm grateful that I've had mentors who have taken me to events and also introduced me to people, because it can be quite intimidating, and started to show me the landscape. One of the absolute biggest things is explaining acronyms, explaining little nuances, tensions of the field, because I mean, sometimes you just think about the way that some of us might talk about this field, and there are so many things that are so foreign to people who are outside of it, and being able to explain that made such a difference. I now know if I'm doing research, what I can look up, all of those areas, and giving youth tools to succeed instead of doing things for them. I had a lot of adult mentors who knew how to set up a meeting, who knew how to make an agenda, and they showed me how to do it. And then I did it from there instead of just doing it for me, because now I get to take those skills with me in any advocacy projects, even just in other projects in my life. And then these are some guiding questions that I like to follow from the perspective of a youth. looking for a mentor is I'll try to ask them, where do you see this field going? And then what can I do to help? And for me, that's been really helpful in framing this idea of mentorship as how can I build on the work being done? How can I learn from what's being done? And then how can I contribute, just like with the cake, my skills, what I have, what I can bring in order to push it forward and be a part of it. Now, this is more about, I think we've been talking a lot about just youth advocacy, but this is about supporting youth labeled with serious emotional disturbance in crisis because I know I'm a youth. I do have mental illness that I have struggled with. And one thing that's been really challenging, to be quite honest, to navigate and really important to say in this work is that a lot of times my advocacy mentors were also the people that I would go to for help. So I had a mentor in college who we were working together to increase access to connect students with mental health resources and try to increase awareness of those resources so that students knew they could go somewhere when they needed help and that it was okay to ask for help. And after we've been working together for about a year during the pandemic, I just hit a real rough spot. And I actually had to reach out to her and ask for help and say, hey, right now I need to be connected with support. And I felt really scared, a little bit embarrassed, but mostly scared. I didn't want to be seen as lesser than as an advocate, as not able to do it, as failing in recovery and not able to live up to it. And she responded perfectly. She was provided reassurance that it was important to seek help. Everything that I was saying to my peers and trying to encourage them to seek help and destigmatize it, that applied to me too. And that if anything, for me to be vocal on campus about the importance of accessing these resources and then accessing them myself, if anything, is building trust and showing that it actually works and that I don't think I don't think you're lesser than just for accessing help. And so to be able to say that, to also start to gain that experience with those resources as somebody who's utilized them and that lived experience that came out of having to ask for help was really beneficial. She did a really good job of prioritizing that my recovery came first, that I didn't necessarily have to get certain projects done when I needed a little bit of a break and I needed to prioritize that. And that first and foremost, she saw me as someone she was a student that she was helping in that role. And then an advocacy mentor. I mean, they're intertwined, but that in that moment, the most important thing is to take care of my well-being. And so I'm really grateful for that mentor. And I do just want to highlight that it can be really important in this area to just be aware, and providing that reassurance went such a long way. And I'm so grateful for that. So now we're moving on to our second learning objective, which is Roger Hart's ladder of participation. And we're going to just start it out here with a quick poll. Have you heard of or utilized Hart's ladder? Okay, I'm going to wait for a couple more results to come in here. All right. So we've got 16% yes and 84% no. I'm going to go ahead and share those results. And actually, that was, I'm going to be honest, before I started working on this, I also had not heard of Hart's Ladder. So it's definitely a learning experience for both of us. I think I'm going to go ahead and X out this poll. All right, and here is Hart's Ladder. It's a really good guide to, it was actually published in UNICEF, and it was called Children's Participation. It also applies to youth participation. And it's thinking about really what it means to engage children or youth in work that pertains to children or youth. So it's got 8 different rungs, and they are ranked levels of engagement. That means that rung 8 is more engaged than rung 4. It's not just some non-hierarchical random assortment of different options. Youth are more engaged when they're at rung 8. And so there might be times where it just makes more sense to have youth engaged at rung 4. I've had plenty of situations where I felt like I was able to contribute to a project. It was adult led. I had a little bit of input in decision making, but I think for me, it might have been time commitments. It didn't necessarily make sense to have a greater engagement, and that was perfectly okay. But what's really important is that youth know that they are able to be engaged at the highest level of participation, even if it's not happening at that moment. Of course, it is ideal when we're really thinking about how to engage youth to have them fully engaged. It is intended for use as a tool, not necessarily as a strict guideline that you follow in absolutely everything. So that is something I think with a lot of these frameworks to just sort of hold them as guidelines, but not necessarily absolutely set in stone what must happen. Now, there's also been some discussion about a ninth rung in youth advocacy circles and saying that there should be a ninth rung added to the ladder. And that ninth rung would describe projects that are fully youth led, as opposed to the eighth rung, which is youth led, but then there's shared decision makings with adults. So I assume that I've been told most of this audience is adults who might work with youth. So as an adult, then we might not be working entirely with youth-led projects. So here's how you can bring some elements of this concept into your work. First off, letting youth discuss without adults. I was working on a peer-to-peer mentorship program for high school and middle school girls. And one time, instead of just sending out a survey for feedback, the adults all took a space from the Zoom room and we let them discuss amongst themselves what they actually thought. And the feedback that we got when we had actually stepped out, not just the feedback, but the relationships that started to develop, the insights that came out of it were so much more valuable than just sort of keeping youth siloed and saying, all right, now the adults are going to ask for your feedback. It was so much better. And I think a lot more came out of that. Connecting youth to other youth. I mentioned that I was able to start a collegiate recovery program at my last university, and a large part of that was adults who connected me to other students who had the same goals, interests, passions in mind. And that was how we actually got to work together. And then being sure not to hinder or resist youth efforts. The Hearts ladder, there were these first three rungs that were actually non-participation. And that could include actively resisting youth participation, trying to keep them off of boards, keep them off of any advisory councils, anything like that. And then also hindering youth by discouraging them from advocacy. And those are some of the more subtle ways that you might imply youth are not capable, imply that they might just not know as much or be able to handle it. And that's a way that you really can, even while saying that you support youth, sort of undermine that. And so making sure that you are encouraging youth still. And work looking at this ladder really made me think about an experience that I had with participation that I thought was very much tied to the eighth rung, which was the one of youth initiated shared decisions with adults as equal partners. When I was 21 years old, I decided to take a break from college and I took an internship at a congressional district office. And in this internship, I got a call from a constituent who was in a mental health crisis. And I'm lucky. I know a lot of people are talking in the chat about certain like mental health response trainings. I know there's a variety of them. I had done mental health first aid training. And so I had that background from my behavioral health, my interest in behavioral health. And actually, that one came because I had wanted to be able to help my friends. And so that's a different type of advocacy. And I was able to thankfully apply it in this situation, be able to get this man connected to further support. And then I started thinking, because at this point I had a little bit more experience with systemic advocacy. And I thought, I wonder if this is a bigger issue than just me. And so I looked into it and I found that there actually weren't any trainings on how to help a constituent experiencing a mental health crisis that were offered to staffers. I did find a webinar on helping to de-escalate difficult callers. And so I went to the webinar and I explored, and they still didn't address it, but it seemed like the man who had run the webinar, I figured he might be receptive. And because of all this advocacy work, I knew how to actually reach out, do a cold email. I found him on LinkedIn. I had all of these like little strategies I had learned for taking that step to reach out and start advocating. And so I set up a meeting with him and I pitched him my idea of, hey, I think we should have some of these trainings offered on the Hill. I think it might be helpful. And I am so lucky that he responded in basically absolutely in line with the eighth rung. I was expecting him to just sort of either take the idea and run with it or not run with it at all. I wasn't expecting to actually be engaged. He outlined the different committees, and he had decades of experience in Congress. And so he outlined the committees that were doing work that might be aligned with this idea. He mentioned the possible legislative avenues that could be pursued. He talked about some of the barriers that had been faced. It turns out people had actually thought of this idea before, but he really encouraged me to think about it and to pursue it. And he showed me some paths that might make sense. And then he told me that he thought I should actually take those paths. We discussed some of the areas. I asked him many questions about why one idea might work better than the other. We were able to collaborate and really have that shared decision making of what could be possibly the best avenue. And he really empowered me to go ahead and pursue that. And for me, it was such a wild experience. I was able to connect with committees, with lawyers, actually national advocacy groups, and start to learn a lot more just through that experience. He also connected me with other people he knew who were able to help me polish my resume so that I could continue. And so he really provided that opportunity for mentorship as well as I got to have this really hands-on experience of advocacy at such a wild level that it really blew my mind being able to participate there. And like I said, I felt like I was an intern. I was 21. I didn't have all this background, and I felt truly like respected, empowered, engaged, and that I really had this chance to learn and that my decisions were really valued. And also that my other experience in advocacy had prepared me. And so, on to that idea of shared decision making. Well, I think it's really important when we talk about decision making that youth and adults are able to ask each other why. And what I mean by that is sort of going down some of those rabbit holes of understanding what's behind a decision, not just taking decisions at face value. So for adults, I think it's important to be able to ask youth why they're doing something to make sure that this is coming from a place of interest, not signaling doubt or a lack of confidence in youth, but really curiosity about what they're doing, about their rationale, to truly engage youth and not just have it be, okay, here's the decision that you're doing, but actually work through those thought processes, work through what's happening. And there's really a lot of chance to learn from youth in what they're doing. Like I said, I think that youth have really unique understandings of the systems of certain areas. They'll also probably have expertise that adults might not have. So to be able to learn from that, I think comes from this transparent communication that I found asking why is just a really good way to start with. For youth, I think asking why is a really good practice in speaking up and not taking everything adults say just at face value, but being able to understand what's behind it and learn from it to be able to build trust with adults. When you can ask an adult, why are you thinking of doing this? And then actually learn, learn the process behind it. One, you might notice something that actually seems like there's a better way to go about it. And two, there's ways you'll start to trust that adults do might have your best interest in mind, might be able to actually work with you. And then, like one of our other bullets, I think it's the last four here are basically the same. I really do think that a lot of times adults and youth can bring a lot of similar things, can really come at this in this idea of collaboration. We both have a lot that we are bringing to the table, a lot that we are learning from each other from this process in working together. And so for me, shared decision making is such an opportunity to learn, to grow, have that transparency, and be a lot more effective in your collaboration in that. So now I want to move on to tokenization versus true engagement. I've been talking a lot about all the happy collaboration, cake analogies, but the truth is that there is also times where there is tokenization, and that's something that we really want to avoid. I know a lot of us have heard this term, and so I just want to ask in the chat, what do you think of when you think of tokenization? And I did have it pointed out to me that it's also a cryptocurrency term, so we're not talking about that, unless you do want to mention it. Mm. Oh. Mm. Yep. Mm. Yes. Oh my gosh, I agree so much with what's being said. Yep. Checking off a box. There's something about it being just for the sake of saying we have a demographic, symbolic, not substantive. So I found a dictionary definition of tokenize. Tokenization was a little bit harder to find, but to treat or view a person in a way indicative or suggestive of tokenism, to use a member of a minority or marginalized group to give the appearance of racial, sexual, etc., equality or diversity within an institution. And I think that really touches on what people were saying, and what I think of is this idea of, oh, tokens are always spent. Oh, I like that. That's a great quote. Thank you for that. Um, but it's the appearance. It's not actual equality or diversity. It's just the appearance of it. So when we're talking about it in this case, I want to then bring up the term of lived experience. And so I'm talking about lived experience as something that is typically, we talked about like the groups that are tokenized. For this, I think of lived experience as the people who we want to include and not tokenize. And for this, it's lived experience refers to representation and understanding of an individual's human experiences, choices, and options, and how those factors influence one's perception of knowledge based on one's own life. People with lived experience are those directly affected by social, health, public health, or other issues and the strategies that aim to address those issues. This gives them insights that can inform and improve systems, research, policies, practices, and programs. And so, in this definition of lived experience, which right now we're talking about youth with SEDs and their lived experience with that, it's really highlighting what we've already been discussing, what a lot of us already know, is that when you engage people with those lived experiences, those people who are directly affected by these programs, by these issues in those systems, their insights can really help to inform and improve those systems. But, and this is, I'm going to be honest, this slide is the one that I'm the most nervous about. I feel like it's also really complicated. And I found in my own experience that I've really grappled with the importance of, like I said, lived experience. People with lived experience must be included in advocacy. These programs, these policies are only going to be successful if the voices of people with lived experiences are included. For me, lived experience is a motivator. It's a tool. It's why I want to do this. It's to see that people who have like similar diagnoses, similar backgrounds to me are able to experience recovery, to see that my friends are able to get connected to help, to see that policies are just like that is a motivator for me. I also think that it's important to do that in a way that's not tokenizing. And it's really, I think it can be really nuanced. I think there are some really easy blanket ways to do this, but at the same time, it is a tension to be mindful of. And for me, the more that I've worked in advocacy and sort of progressed in my own recovery journey, I've found that I'll tell you a bit of a story, which is that I was considering being a part of this grant, and I didn't know if they had reached out to me because I was a youth with mental health conditions or because I had experience in several advocacy projects. And at that point, I was in a place where I was sort of struggling with like how much I wanted my identity to be directly tied to and sort of the reason for my work. And so I'm really grateful. I reached out to a mentor and she said, well, ask them. Are you going to be listed as a young person with lived experience or a young professional with experience implementing programs? And in that moment in my life, I really wanted to be identified as a young professional with experience implementing programs. And so I'm really grateful. I think it's that lived experience is such a crucial part of what makes me an advocate. It's a part, though, it's not the entire whole. I'm also an advocate because I have a passion for it, because I've started to gain experience working in it. And so I think sort of respecting youth as professionals, not just patients. And like I said, I really do struggle with this slide because I think it's a really delicate and complicated issue of the fact that we do need to value that lived experience is expertise. Also, to not reduce somebody to just their lived experience while also uplifting it. And so I don't know. I'm sure I'm not doing this perfectly. I just think that it's a really important thing to consider and be aware of. And that lived experience is not the only thing that youth have to contribute as advocates. And that's not to say that it isn't something they contribute. So hopefully there's at least some food for thought there. I know that it's been really beneficial for me to just have mentors who help me navigate some of those nuances, who help me say, here are different ways that you can ask to be identified in this work. And now I want to talk about just some of those ways I mentioned that I think are really important for starting to reduce tokenism. Compensate youth fairly. Think about how adults would be compensated. Also, sometimes adults will be getting paid for something that youth aren't. Like they'll be getting paid through a job. So consider what an adult might be getting and how you can compensate travel. Youth are working. It is an honor sometimes to be able to be engaged in this work. That also means that it should also be paid and fairly. Involving youth at all stages of the process in development, taking youth input seriously, not just having it as a little thing that you can tack on and say, look, we asked youth what they thought, and then ignoring it because it's a little bit too hard to incorporate. In fact, ask youth how it can be incorporated. Work with youth, collaborate with youth, invite other youth. I know that, and I'm sure if other people have probably experienced this too, the feeling of looking around at an event and realizing I am the only person who is being asked to speak for an entire group of people that I can hardly represent as just one person. And it is incredibly intimidating, it is isolating, and it's just for me, I think that's a really quick path to tokenization. So inviting more than one youth, having youth there, youth can work together. That's another really good part of true engagement that kind of gets back to the ninth rung. Giving recognition and credit for the work of youth. Their ideas are not just like feedback on a survey, they're ideas, they're intentional, they're thought out, they come from expertise. Giving youth the chance to learn, and then also for adults to have the humility to learn from youth. I think I've touched on it a few times. I really do believe that adults can gain so much and that there's so much value that youth do bring from this work. And so being able to recognize that and recognize the position of we're all here to actually learn, we all have that growth mindset, I think is really important for taking that step towards true engagement and valuing youth for their expertise. And now I want to talk, I think this is somewhat related for me to this idea of lived experience and where I find it comes up the most about this idea of self-disclosure. So in the chat, can you think of, are there any reasons that youth may not want to be publicly labeled with serious emotional disturbance? Mhm. Yep. Mhm. Yeah. Yeah. I'm seeing a lot about, yep, loss of friends and jobs, hiring. I have a good friend who wants to go into finance, and her worst nightmare is people finding out she went to treatment. Stigma, targeted judgment, seen as making excuses, limiting their identity, all of this. I know for me, there's also been concern at times of it being triggering. Yeah, and I will be honest. Yeah, who wants to be stigmatized as disturbed? Absolutely. There are so many reasons where youth may not want that to be just broadcasted in that way. However, in my experience, when I was I kind of wanted to shout from the rooftops at first. I was so excited. I learned that basically, if I have this lived experience, if I can check this box, that's going to help me get really far in this field. And so I really just wanted to say all of these exciting things and really just share my story as broadly as possible. And I am so, so lucky that I had mentors who had been in similar positions who were able to kind of rein me in a little bit and really protect me and help me understand and help to really explain to me their experience and some of the nuances of self-disclosure. Like we said, there is still profound stigma in many fields and just in general. And my mentors explained that youth with lived experience have a right to autonomy and privacy over their story. Because as I've continued in this work, and just like throughout my recovery journey, I've changed a lot, I've shifted, and I'm really grateful that I still have privacy because I didn't necessarily broadcast in the way that I might have wanted to at first, that I get to choose now how much I share, who I share it with, in what capacity I share it. And I feel protected. And many grants require lived experience. And as I mentioned, this inclusion is so important. Also, it's once again that really tricky balance of stories are more than requirements for just grants. They help this advocacy, they help the voices should be included and also not reduced to just a requirement for a grant. Recovery journeys are personal and should have a degree of separation from professional identity. I really struggled with this last year. I had some big things happen in my life, and I felt um, really just afraid. I didn't want this deep like narrative, this thing that's so core to me to just be my professional identity and be tied to whether or not I was going to succeed. I really wanted it to be that's for me. That's for my own well-being. That's for my family. That's for my friends. Like that side of me is different than what I necessarily am able to contribute in a field, how I show up in that capacity. And so I'm really grateful. I feel that my mentors have helped me, and just time has sort of helped me to start to better navigate what it means to show up in a workspace where my story is valuable, is part of the work, but then also keep my story for myself in a way. And part of that's that there's really a spectrum of strategic self-disclosure. I don't have to tell everybody every intimate detail of parts of my life in order to say I have lived experience and this is something I can contribute. I can share broadly. I can also share a very specific example. And one thing I think is really important to address is that when we ask youth to share their stories, we're doing so for a purpose. We're doing so with an intention. And that's not a bad thing. Oftentimes our intention is maybe to get more funding for the programs that help youth, to understand how we can fix these programs. But there is an intention behind it. And so I think it's really important to be transparent with youth about the fact that, hey, this is why we want your story. And this is what we're trying to do, and also to empower youth to have their own intention, their own meaning, to let them know. And this is what I start to do now is I'll ask when somebody wants me to share something personal for something, who is the audience? What is the intention? What are the messages? And I start to actually craft my own message and point and think, all right, if I have ownership over my story and I get to speak to this audience, what do I want them to know? And I'll then decide to be intentional about highlighting the aspects of my story that I think will really further that intention, as opposed to kind of just here it is, here's a free for all. And that makes me feel like I have autonomy, I have ownership over my story, not that it's necessarily being used, that I'm being put on a pedestal. And so I think having that conversation and that transparency with youth is really, really important, and letting them recognize the way that it can actually be a tool and something that they have real agency over. So now that we're starting to wrap up our webinar, I just want to talk a little bit about advocacy and practice and wrap up some of these stories. So here are some levels of advocacy as a guiding thoughts. Self-advocacy refers to an individual's ability to effectively communicate, convey, negotiate, or assert his or her own desires, needs, and rights. I think about that as me being able to ask the disability office for help in school. Individual advocacy is when a person or group of people concentrate their efforts on just one or two individuals. I think about that as like being able to help a friend navigate systems. And systems advocacy is about changing policies, laws, or rules that impact how someone lives their life. These efforts can be targeted at a local, state, or national agency. The focus can be on changing laws or simply written or unwritten policy. I just want to follow up on that story I told you about the mental health trainings in Congress and say that actually we didn't have to change any laws for that. Turned out that there was some areas that it was able to be accomplished without legislation. And so being creative about this, being creative about the different avenues that systems change can actually happen. And on that, once again, I still think that it is absolutely blows my mind that when I was 21, I was able to be engaged in advocacy at that effort, that I was at that level, that I was able to develop and advocate for myself, advocate for others. And as I was working through this presentation, I started to think it actually isn't so unbelievable that that happened, because I looked at the role that mentors have played in my life, that mentors like you all who work with youth were able to play in helping me grow and actually be able to make a difference. So I tried to sort of boil it down to what your role can be. I think that's respect, treat youth advocates in ways that uplift rather than tokenize, support, mentor and support youth as both advocates and individuals with SEDs, engage, utilize Heart's ladder to ensure that youth are fully included. And with that, I just want to say truly from the bottom of my heart, thank you so, so much. I am so grateful for you all being here today. I'm so grateful for the work that you do every day, the support of adults in my life to help me grow, to help me step into advocacy has just been absolutely invaluable. And I know that you all work with youth who want to do this work, who you are able to engage. And I really appreciate you taking the time to be here today. And with that, I will turn it over to questions, I believe.
Hello, my name is Felicity Kruger, and I'm going to be kind of reading out questions for Joe that you guys have been putting in the chat. I'm trying to go back to find the ones that we answered earlier. Um, Sorry, had it and then things came up. So we have one question that asks, how do you balance more structured mentoring conversations and fostering their leadership and well-being in reference to not everybody knows their own crisis. So how can we manage structured mentoring conversations?
Sorry, could you read the last part of the question again? A bit about not everybody knows their own crisis.
So the full thing is youth may not know what they need in crisis or skills acquisition because of the unfamiliarity. It can also feel too open-ended to some. So how do you feel, or how do you balance more structured mentoring conversations and while also fostering their leadership and well-being?
So I would say in my experience, if a youth is in a crisis and has needs, that comes first. When I go to my mentor and I am having a moment and I really, really need support with my mental health and I'm in crisis, that's not necessarily the time for me to talk about leadership, except in the capacity of me asking for help is showing leadership, showing initiative, but really keeping it boiled down to if I'm in a moment where I need support. I need support with my well-being, that's the priority. That's what comes first. And the only way that I would really like tack that on to that idea of leadership is as that form of reassurance and saying that you're not less of a leader for seeking support. If anything, you're more of a leader and you can get support and then you can tell people. But I think it's that metaphor of you put your own oxygen mask on before helping others. And then you can advocate for the great, like how great oxygen masks are once you have one.
Mhm. Thank you so much, Joe. We also have a couple questions that are kind of like multiple people
Yeah.
ask a similar thing. So it's about adultism in youth mental health and advocacy spaces. So some people ask kind of what you mean by adults with like the Heart's Ladder and how to dismantle adultism in youth spaces.
Yeah. So I think adultism, I'm gonna be honest, I haven't done as much reading on this topic particularly. Um, by adults, I think I was just using it quite broadly to explain whether it was like the assistant dean at my school, supervisor, sometimes people who I really wasn't that removed in age from. I think those relationships where it was very clear that I was more of the youth and I came from the youth background and that was what I brought to the table. And then also, or in situations where I was an intern and there were people who were full-time staff, I think adult can be a little bit more, I think there's some cases where it's a little bit more murky or broad, and there's some cases where it isn't. For me, when I think about, I believe adultism is sort of that idea that youth, correct me if I'm like, really aren't capable or up to the task, or that adults can do more. And that's where I really like to go back to the analogy of like the cake, and that actually adults need youth. Adults are not going to succeed if they don't ask youth for help. And so for adults in my life to actually voice that and to voice that our work is not going to succeed unless you can bring to the table what you have has made me feel like an equal partner. And the truth is that we are equal partners. because they're not lying when they were not lying when they said, hey, our work is not able to reach as many youth without your help. And so that I think was really, really important for me in dismantling that idea of it's a hierarchy, I'm not capable, is that really it's humility, like having the humility to recognize that we both need each other, that I actually, a lot of these projects, I would not have been able to accomplish them on my own, but adults wouldn't have been able to accomplish them without me either. And I think that's just working together. And so that's how I've sort of started to try and undermine that mentality.
Thank you so much. I feel like you answered that question beautifully, Joe. So we have another person who, when you were discussing professional identity, asked, hoping you will say a little bit more about the degree of separation from a professional identity and what this means.
Yeah, I think for me, it's that I realize that my recovery journey is ongoing and that the things that I'm processing in that space and working through, they don't need to be connected to my career. I can work through, I can have a support network, I can have my family, I can have therapists, I can have support, but that this idea, I've started to move past this idea of like, I need to be in perfect mental health all of the time in order to be effective as an advocate, because that's what I bring, is that I am this like model of perfect mental health or something like that. And that I'm really grateful. And I think part of this is for me, I think that's part of why I'm almost starting to want to move away from lived experience as this big identifier, is also because I kind of want that to be something that I can keep really private and treasured and safe and protected, and into the fact that now that it's been a few years, like I've developed skills as an advocate. I've developed a good understanding of legislation, of some congressional processes, of implementation. And that's something that I can really start to bring to the table. And so the professional identity versus that personal one for me is really thinking about the fact that things that maybe aren't healed yet, especially, don't necessarily need to come into my work. Not in the sense that like I couldn't talk about them with mentors, with people important to me, but that like I'm not less than as an advocate just because I still have I am not perfect, which nobody is, because I still have things that I'm working through. And so letting there be a little bit more privacy in that area of my life and being able to say I have lived experience and then choose how much or how little I want to share about that in relation to work has been really, really important for me.
For sure. Thank you so much. I say I definitely get a lot out of that, and I'm happy that you shared that. Um, so we have about 5 minutes left. If anybody has any last minute questions, please feel free to use the chat. But I also want to ask Joe, maybe while we're waiting, Joe, what are your plans for your future? What your job's gonna look like? What your life's gonna look like? Anything you want to shout
Oh my
out?
God. Sure. So actually, I've recently had some pretty big updates to my future. I love advocacy. My dream is to continue working in mental health advocacy. I actually got into law school recently. So I'm hoping that, that will be another thing that I can bring to the table in this work, because a lot of times when I've done work, I realize like I just can't understand, I can't write bills, and that's an area that I'd like to grow and be able to bring that to the table. I'll be staying in DC, and I know I've started to get more involved with some events at SAMHSA and meet more people there, and it's really just been a wonderful place. And so I'm really looking forward to that. No idea what it'll bring, but I think one thing I've learned is that now I get to actually take risks that are like fear of being rejected, fear of things not working out. And so it's pretty amazing that I get to do that now. Yeah.
That's so cool. Congratulations,
Yeah.
Joe.
Thank you so much. Um,
We have
Definitely let me know. I
one.
know we bumped into, oh, sorry.
Go ahead.
I was gonna say there was one time I remember I was interning at the Senate and I actually bumped into Felicity in the Senate, and that was wonderful. So let me know if you're in DC again.
Sure. We have one question, probably be our last question. For an organization that works exclusively 18 plus, would
Mm.
you have a recommendation to engage with youth at a college level?
Oh, absolutely. I mean, majority of my advocacy has been 18 plus. I think it depends on the organization, if it's within a college, outside of a college. No matter what it is, the first way to engage with youth is to find a youth partner. You're not going to be effective unless there's a youth who's interested in it. And it's once you're able to actually find that real like youth champion, ask them what they need, ask them what the college needs, because every university or college is different. It's going to have I mean, I transferred and I thought that I could go start a CRP at my new college, and I did not realize that the culture, the structure would be so vastly different, and it was a lot harder, and it was just like a lot, there were very, very different needs than what had been at my last college. And so really, as soon as you can, get that student ally, that student partner, and be open about here's what I have to offer, but most importantly, ask them what their needs are and where they see the gaps are.
Thank you so much, Joe. So we have like 2 minutes left. So I guess if you guys have any more questions, there'll be ways to reach out to Joe, to the people kind of running the webinar outside of this webinar. And we thank you all for being here, and we thank Joe for coming and presenting.
Thank you so much.
Thank you so much. If the presenters will please stay connected, that does conclude our session for today. Everyone else may disconnect.